Expo? Show of hands, how many people went to the dinner last night? Oh, I'm glad to see people are awake. Did everybody have a good time, those that went? Yeah. It's pretty sad. It was a very good evening, and I want to compliment both the host committee as well as the staff that works for us that put that on. I think everyone had a great time, so a good way to end the first part of the week and kick us off into this part of the week. So we want to start with a little overview of Bratislava. I guess we're not going to do it. Kelly, help. I'm not technology literate. Thank you. Needless to say, a very beautiful country and a very beautiful city. Please do not spend all your time in this hotel. Do get out and explore. It's certainly worthwhile. So welcome to the SNOMED CT Expo. I want to talk a little bit about SNOMED. For those who are the converted, you'll know this off by heart, but there are some new people here. In 2016, the organization developed a new strategy with a new vision and mission. And our mission really is, in a nutshell, to start to get to a point where end users can use clinical terminologies and have them to be easily consumable within their systems. Most of the Standards that we use in healthcare work together, but it's sometimes complex for them to bind together and be used effectively and efficiently. And part of the mission of our organization is to ensure that we try to work with all of those standards organizations so that if you use SNOMED CT, those other standards will automatically work better and more effectively and efficiently. Our mission statement, really we produce and enhance the terminology that enables the clear exchange of health information for all. In fact, I was in Switzerland where someone like in SNOMED to really the glue or the thesaurus in the middle that translates what is happening in healthcare with the support and interchange with all of the other standards that are out there. We have really three strategic directions. First is around SNOMED as a product, and really for us, one of the reasons why we have a business model that we have, and we have equal representation at the table from our member countries, is to allow us to invest in the product itself. And for us, we want to continuously develop and quality assure SNOMED CT so that it still maintains its integrity as medicine changes over time. And for us, the way to do that is to also seek input from our customers. Secondly, unlike some other standards organizations that are out there, we also believe that it's not just about receiving the standard, it's about what services can we provide to help our customers in using that standard, whether that be education or the use of tools that are open source that they can easily adapt to manage that terminology. And lastly, we also produce some tools that allow us to remove barriers. And some of those barriers are the translation and also producing more finite sets of SNOMED CT for very specific use cases. And lastly, we can never stand still. We always have to innovate. We're always challenged to ensure that we are efficient and effective as an organization and to drive value. And so for us, we look at what's happening in medicine, and especially the buzzword in medicine today is both precision medicine as it relates to some initiatives in North America, but also genomics, which is global in nature. Here's a snapshot of our members. You probably can't see at the back all of our members, but we do display this on our website. And I would say that list early in the new year will grow by at least 4 new member countries. I should also say that we are in the process of finalizing a memorandum of understanding with China, and we anticipate that they will join the organization in 2020, just before the Olympics are held in that country. The other thing that we do is we collaborate. We have over 30 collaboration agreements, both with other standards organizations, so that we can work together to ensure that the standards work seamlessly. But we've also branched out and we work with other organizations and very, very large vendors who are doing innovative things in the marketplace. So IBM Watson, we have a global license with IBM, and Watson has SNOMED inside. Watson is starting to learn about SNOMED, and we hope that will be able to enhance its predictive analytics capability and help inform the artificial intelligence. Google, we have a license with Google. Google tried to develop their own terminology as it relates to their dictionaries behind the scenes for their search engines and other tools that they use. And so they've decided to use SNOMED, and they've started to look at how they can deploy SNOMED under the covers of what they do. We also are part of the Joint Initiative Council, which is comprised of the 10 largest standards organizations that are outside of the ISO ballot process. We have ISO as part of that group as well. And that group really over the past year and a half has been developing a starter set that will be released in November of standards. So it will be given to the world to basically help them understand what the process should be in order to build a use case, how you select the standards that will be used, then how you implement those standards, how you conformance test those standards, and how you certify those standards. So that will be released. We are working with HIMSS to basically look at how we can play an important role in the Olympic Games. We have athletes that come from all over the world. We have people that come from all over the world. And wouldn't it be nice if they have, in the unfortunate event of needing medical care, the clinicians in those Olympic host countries can access some relevant patient information, either to renew prescriptions or to take a look at some of their past medical illnesses so that they can treat them effectively and quickly. And we think that that is a great demonstrator or showcase, so we're actively involved in that initiative. I should say that for the 2018 Games, we are working with the medical vendor, General Electric, to determine whether or not we can translate SNOMED CT into Korean so that they can use it in their product for those Olympic Games, which is a precursor to the work we're doing with the Olympic Health Initiative. Lastly, we last year entered into a partnership with the American Medical Association, really looking at how you tie what is happening in the clinical space to also be able to provide that financial intelligence that decision makers need in order to determine whether or not their health system is performing efficiently and effectively, whether they need to make some resource adjustments. So we are working with them both on that initiative, but recently this week the American Medical Association took a bold step and has decided that they're launching a new interoperability health model in the United States, and they're bringing together clinicians and other stakeholders to help develop a consistent system that will not only structure and allow clinicians to do some analytics and provide better care, but also as a knowledge base. So they're also looking at clinical pathways and how they can start to standardize those clinical pathways to provide more effective and efficient care. On the left-hand side, there is the Apple. We have been into initial discussions with Apple. Apple has a different model of how they want to do things, and they're looking to empower the patient through the devices that they provide the world. And so we are in early exploratory stages with Apple. We have had 4 days of very good business meetings, and some of the things that we have done over the first few days, we've had clinical reference groups that have met and done real work on providing additional clinical advice to the organization as well as content. We have a number of advisory groups from the community that advise the organization in various areas to help us move forward. And again, it's about our engagement to the community. We also have project groups, and they're people that do the real work and the heavy lifting from the community to support us. And then we have our management board, which basically is charged with the oversight of the organization, and they've spent a very good 2.5 days working with the General Assembly, which is representatives from our member countries, to move forward and have very productive discussions on the way forward, both on how we stay efficient and how we stay forward-looking. And lastly, we have what we call a member forum. These are representatives from the national release centers, and they're the people that tell us what we're doing right and what we're doing wrong, and help us find collective solutions to move the organization forward. Last night, we had a very good evening, as I said before, but it wasn't all pleasure. There was a little bit of business. We honored Bruce Goldberg with the annual Award of Excellence, and we also honor Betsy Humphreys, who has just recently retired from the National Library of Medicine after 44 years of service. She is a global leader in moving forward with the digital agenda, especially as it relates to healthcare. And she received not only the Award of Excellence, but also the Lifetime Achievement Award. So I'd like to just honor both of those again today. Expo information, everything is on this floor. So we have registration just outside in the foyer. We have the exhibit hall with some of the vendors who are using SNOMED CT. So during the breaks and at lunch, hopefully, you'll get a chance and opportunity to free up some time to speak to them. And then lunch today is upstairs in the restaurant. So just walk in and enjoy the great food that we've enjoyed all week. And the program locations, again, are all on this floor. I know you can't see the schematic, but we have the breakout sessions, conference sessions, poster presentations and tutorials, as well as other meetings happening. We have keynote speakers. We'll introduce both of those in a moment. And then we have a very interesting panel discussion that will happen after our keynote speakers. And again, those will be introduced by the moderator, Jeremy Thorp, who is the Vice Chair of the Management Board. And then tomorrow, we have a James Reed Memorial Lecture, and we have Dr. Thiel coming from Canada. He has been using SNOMED CT for a number of years, and he can share real-world insights about some of the good things that have happened with SNOMED CT and also some of the pitfalls to avoid. But he really will share the power of how it's transformed the care and how care is provided at North York General Hospital in one of our largest cities in Canada, Toronto, Ontario. Lastly, if you want to have something right at your fingertips for the next 2 days to deal with logistics, you can access our app, download it, and that gives you the program, who the speakers are, some social information. You can actually start to connect with other people that have the app and schedule meetings. And certainly we have some Twitter hashtags that you can use. So all of that is available, and you can also, if you're having issues with the app, you can check with the registration desk and they can help you access it and download it. I just want to recognize our sponsors. Obviously, these conferences take a lot of work and effort, and we're pleased to recognize our sponsors that are listed here: Health Term, Clinical Architecture, Vander, the National Center for Healthcare Information Systems in Poland, FAST, and also IMO, Intelligent Medical Objects. So thank you to our sponsors, and as I said before, please make a point of at least dropping by and saying hello at their booths out there. I also want to thank the Slovak Republic National Health Information Center, who's been our host. They have done a great job in working with us to put this conference on. And I also want to recognize the people that support the organization, our General Assembly members who come from the member countries, some from very long distances, to advise us and direct us on the way forward. Our management board, which is made up of representatives from all over the world as well, who come and work with our General Assembly members. And also the member forum, which represents the national release centers. They also spend a lot of time and effort, not just at the conferences, but throughout the year advising us. I'd like to do a special thank you to the community of practice, which come, they're passionate, they're driven, and they drive us. And lastly, to the great staff that support all of us in moving SNOMED CT forward. So I want to thank you. I am now done, and we'll move to the next spot on the agenda. So at this point, it is my great honor to be able to introduce our keynote speakers this morning. We're fortunate to have Minister of Health, Dr. Tomas Drucker, who has made time in his schedule to address us today on the health and e-health activities currently being pursued in the Slovak Republic. Dr. Drucker is a graduate of the Faculty of Law from the Trevana University, Slovak Republic, and from the Department of Applied Informatics and Automation in Industry at the Slovak Technical University in Bratislava. Over the years, Minister Drucker has worked in both consultancy and managerial positions in several companies. In 2016, Minister Drucker was awarded the most respected CEO 2016 award from Forbes magazine and PwC Consulting Company. On the 23rd of March 2016, the President of Slovak Republic appointed him to the position of Minister of Health of the Slovak Republic, and I welcome the opportunity to learn more about Slovak's eHealth project, as I'm sure you do. Please join me now in welcoming Minister Drucker.
Mr. Secretary, ladies and gentlemen, participants of the conference. Allow me in the beginning my speech to warmly say hello to you, and I'm really glad to have the honor to participate of this prestigious event organized this year in our country. By the way, very nice country, I hope you like it. Slovakia is represented in International Health Terminology Standards Development Organization by Slovak National Healthcare Center, Information Center. Slovak Republic has recently opened SNOMED National Reference Center, and I hope you will agree with me that SNOMED is the most complex and most accurate clinical terminology in the world. To say it more simply what it means using SNOMED, it means information system will understand each other in case their communication will be based on standards. We believe that appropriate coding of clinical information will bring benefits to physicians, healthcare professionals, patients, and all healthcare providers as well. And this is really the case. Providing the right clinical information in the right time and the right place must be one of the goals of eHealth. The real operation of eHealth in Slovak Republic will start up in the beginning of next year. I have to say, with all the worries and issues which such a big project brings. However, it's the necessity step for our future to do better decisions based on better data and make better healthcare in Slovakia. We are putting into practice also a few other projects, such a new payment system based on DRG, payment for diagnosis. It is gradually progressing since the beginning of this year. Practically all the healthcare providers have already signed the agreements with health insurance companies. In the highest stage of development, there is one, the closely related project, standard diagnostic and therapeutic procedures. The project represented one of the most important management tools. It will not only ensure a rational reallocation of financial resources from the public healthcare insurance, but also will ensure the improvement of the quality, efficiency, and availability of the provision of healthcare services to the patients, and will bring result-oriented indicator. There is also the other very important project we are now working on. It deals with long-term social care. Our priority in this area is to decrease the number of acute beds and increase the number of chronic beds. As we all know, population in developed countries is getting older and older. And we have to recognize today the situation which will happen in 2030, years and plan not only the structure of capacities for healthcare provision to greater number and older citizens, but also plan economical sustainability. And that is a challenge we can only face as community of cooperating countries. The key issues that need to be addressed now also include prevention and support for healthy living. We see prevention and such a support as an important tool for maintaining long-term health and quality of life. I believe this meeting of experts will provide us with important information, interesting discussion, and will contribute to the useful exchange of the most up-to-date knowledge in this era. Thank you very much.
Thank you, Mr. Minister. Clearly, healthcare in the world today faces daunting challenges, especially as the population ages, and we try to figure out how to manage our populations effectively with the chronic diseases and other ailments that we're starting to see as we all grow older. So we look forward to your progress and also hope to learn from some of the things that you and your country and health department move forward with. Now I'd like to introduce our next keynote speaker, and I apologize if I don't get the pronunciation of the name right. Deputy Minister Marek Tombarkiewicz. He is a doctor of medicine, specialist in anesthesiology and intensive care medicine, as well as a specialist in emergency medicine. From 2001 to 2007, he served as the head of accident and emergency department of the specialist hospital in Koniński. Since 2006, he served as the emergency medicine representative to the governor until 2008, and he is the consultant for emergency medicine up until 2016. In 2007, he was appointed general manager of the independent public complex of healthcare facilities in Stashow, where he had served as the deputy head of the Department of Anesthesiology and Intensive Care Medicine from 1999 to 2001. The deputy minister was appointed the Undersecretary of State to the Polish Ministry of Health in early January 2016. I think that you'll agree with me that one of the benefits of hosting international events is that our community gets exposure to health and eHealth priorities and activities from around the world, and we look forward to his comments on these topics. Welcome.
Mr. Minister, ladies and gentlemen, it's a great pleasure for me to be present here among distinguished SNOMED and healthcare IT experts. I'm glad that the eminent guests from all over the world are here with us. For me, it's an excellent opportunity to briefly present what we do in relation to the SNOMED in Poland. I would also like to share my opinion on the SNOMED terminology. At this point, I wish to express my great happiness about the fact that you elected the director of the Center of Healthcare Information Systems, Mr. Marcin Węgrzyniak, as chair of the General Assembly. This is not only an expression of great recognition from Mr. Węgrzyniak, but also an important honor for my country, for Poland. For many years, we have been working in Poland on developing the application on the SNOMED city terminology in daily healthcare practice. In my opinion, the SNOMED gives opportunities of a good description of diagnosis, medical procedures and condition of their execution. Very interesting is the precision of topography of the human body and the context of its functioning, which may be categorized through the use of the ontological model applied in the SNOMED. This is one of the reasons for which this terminology is very attractive. It's also worth stressing that the European Commission recommends using the SNOMED city in the description called patient summary. In Poland, we also take this into account and we're going to start work on it. However, it's worth noting that the current practical application of medical classifications still too poorly uses a huge potential hidden in the SNOMED city terminology. Still, the main database for recording and encoding medical conditions is the ICD-10 classification, and the medical procedures we have ICD-9 classification. I do not think that this situation will change soon. After all, we have a long-term established tradition of using this WHO classification, and there are no reasonable grounds for any rapid change in this approach. Therefore, a big advantage of SNOMED city are mappings with other WHO classifications. In Poland, we are mostly interested in the mappings between the SNOMED city and the ICD-10 and ICD-9 classification. Important for us are also the mappings between the ICNP classification for nursing practice and the SNOMED city. In the future, we will the mappings to the WHO ICF classification, as in Poland we are increasingly using ICF. Another challenge which is facing use the analysis of the capabilities of use and possible implementation of ICD-11 classification. I think it's good that the WHO and SNOMED International cooperate. However, for us a certain unknown remains the final form of the ICD-11 classification, and whatever is possible for the ICD-11 and SNOMED city to coexist. In this regard, we are still awaiting decision. From my point of view, not only as the Undersecretary of State in the Ministry of Health, but also as a doctor, it seems that another step in the development of medical classifications should follow the path proposed by the SNOMED, that is describing medical events according to the ontological models. In fact, at the present stage of development of medical IT systems, it's necessary to develop such technological solution in which we will be able to use IT decision support methods, systems and multidimensional analysis, and systems to support carrying out the process of diagnosis and treating patients. Among others, for this reason, I think that the approach proposed by the SNOMED is interesting and prospective. Taking the opportunity, I would also like to make you more familiar with the current development of eHealth in Poland. The Act of 28 April 2011 on the Healthcare Information System, together with the implementing acts, forms a legal framework for the operation of the Healthcare Information System and provides a basis for implementing in Poland the solution supporting the exchange of medical data used in the treatment process. According to the Act, IT solutions are being created with which it's possible to prepare tools for implementing the Healthcare Information System and keeping the electronic medical records in medical establishment. In accordance with the above Act, healthcare service providers will be required to keep the electronic medical documentation as from 1st January 2019, using electronic prescription as from 1st January 2020, issuing electronic referrals as from 1st January 2021, sharing the data contained in the electronic medical documentation as from 1st January 2021. The Ministry of Health carries out multi-dimensional activities aimed at informatizing the medical market, whereby the most important are first of all the effective implementation of IT solutions to be carried out as part of the project entitled Electronic Platform for Collection, Analysis and Sharing of Digital Resources about Medical Events is Project P1. The scope of the project includes inter alia support for electronic prescription, support for electronic referrals, handling medical events, exchange of the electronic medical documentation, publishing platform, data warehouse and fraud detection system, support for the central list of healthcare service recipients, providers, medical employees, register of medicines and payers, patients online account and application for healthcare service providers and pharmacies. I wish to inform you that on 4 August, the Minister of Digitization and the Minister of Health entered into agreement under which the eHealth program was established, covering a series of comprehensive activities, including the development and periodical update of a strategy paper in the terms of developing eHealth in Poland. Currently, there is ongoing work on the first edition of the eHealth strategy to be completed by the end of December. The action plan is to be created within 90 days from the date of approval of the strategy. Both documents cover a period of 5 years till 2018-2022 and will be updated on an annual basis. The main objectives of the eHealth strategy are associated with better treatment, better management and digital transformation. I should be stressed that the Minister of Health also remains interested in the issue of development of telemedicine. This area has been included in the strategy for responsible development to 2020 as one of the so-called flagship projects, and is one of the key elements of the above-mentioned eHealth program. The current legislation in Poland provides for no obstacles to providing healthcare services through the electronic ICT systems or communication systems. However, having regard to the relatively small scale, the possible activities are being analyzed to make the development of telemedicine more dynamic. For example, as part of the eHealth program, the possibilities of adding telemedical devices to the healthcare service basket will be analyzed, and the potential legal barriers to the potential development of telemedicine will be considered. Finally, I would to strongly emphasize that the implementation of modern technologies in healthcare means, first of all, the improved quality and safety of treatment and its effectiveness. In addition, the implementation of IT solutions allows to make this process patient-centered and provide the patient with access to their own medical data. In conclusion, I will have many interesting meetings and conversations during this year's SNOMED Expo exhibition. Thank you very much for the invitation to participate in this great event. I'm greatly honored to be here with you. Thank you for your attention.
We now have a panel session. I'm not quite as tall as the other gentlemen. Thank you very much for your comments. Can I invite the panel members to come forward, please? I might need to show where you're seated. We're not actually breaking at this stage, but any of you who feel the need to get up, shake a bit and kind of turn around before sitting down and before we start the panel session, please feel free to do so. So we're thinking in this next session about the importance of semantic interoperability in Europe. And an important part of this is trying to work through, so what are we aiming to achieve? And I was just picking up from the Slovak Minister of Health. He had talked about better decisions from better data, and the Polish Undersecretary had talked about better treatment, better management. And from each of the talks you could understand some of their thinking in terms of what might we achieve through semantic interoperability, through an appropriate strategy in terms of supporting terminology. Pavol is just on his way. What we will do, I think, is invite the members of the panel just to introduce themselves first, to say who they are and where they're from. And then I'll be asking each in turn questions. Pavol, do you have a... You will start. In which case, Peter, given the order you're in, Peter, do you want to introduce yourself first?
Thank you, Jeremy. Good morning, everybody. My name is Peter Brosch. I'm replacing Clemens Auer, which you might have seen on a earlier version of the program for today. I work at the Federal Ministry of Health and Women's Affairs in Austria. My main job is about maintenance and development of the Austrian DRG system and work on documentation. I was also deeply involved in the EPSOS project for many years, and now I'm a member of the Semantic task force group of the Commission. And yes, that's for a first introduction. Yeah.
Thank you, Peter. Can I just encourage other members of the panel? Peter, you came across fine. Pretend that the microphone is an ice cream, so you want it quite close to your mouth. Just so we can hear. Tapani.
Good morning. My name is Tapani Piha. I'm the head of unit for cross-border healthcare and eHealth in the European Commission. And it's interesting to come here in Bratislava. I'm coming directly from Estonia, where the European Union presidency country Estonia had an eHealth conference. And of course, the topics we are discussing here were also discussed in Tallinn. I myself, I'm a medical doctor by training, but I have been working in different administrative positions in my home country, Finland, in the World Health Organization, and now since 2001 in the European Commission in different capacities.
Okay, excellent, thank you. I'm coming to Marcin Węgrzyniak.
I think it's better than yesterday.
I've been practicing.
Good morning, everybody. My name is Marcin Węgrzyniak. I'm the CEO of the National Center for Healthcare Information System in Poland. We are the eHealth agenda of the Ministry of Health. I'm the CEO since 1st of January 2016. Previously, I was a project manager and a program manager at this unit. So that's all for now.
Thank you. Robert Vander.
Good morning. My name is Robert van der Stichele. I am a practicing general practitioner and also a professor in clinical pharmacology at the University of Ghent in Belgium. The reason why I'm here is probably because I cooperated intensely in the project Assess CT, which was a European project where the EU demanded an advice to the community of medical informaticians on what the way ahead with SNOMED would be. I collaborated intensely in this project and in the end report, and I'm here to present the conclusions of that project, but also to take the perspective from the end user, the patient, and the physician.
Excellent. Thank you, Robert. And Pavol, Rieger.
Hello, everybody. I'm really happy to see you so many, and I would like warmly say hello to all the former members of EPSOS project. You are among us. I am replacing here our CEO, Mr. Blaškovič, and I have also a couple of functions. I'm deputy representative of Slovak Republic in eHealth network, and I'm also a member of IHMSEC group, and I'm also representing Slovak Republic in the General Assembly of SNOMED. Thank you very much.
Thank you, Pavol. Now, Don, in his introductory talk, was describing how SNOMED International operated at a global level. Our focus in this session is unashamedly within Europe, but what we want to bring across is a sense of how within Europe we're working both together and at country level in taking forward our whole eHealth agenda, of which semantic interoperability is an important part. I reserve the right, if it sounds as though we're being too European or we're using terms that may not be understood by a global audience, to try and expand just so we kind of make sure that we all have a common understanding of what we're doing here. But I'd like to start, Tapani, from the European Commission. I know you've been kind of providing visionary leadership in terms of what things might happen, how things can be taken forward in Europe. Perhaps you'd like to explain a bit about that and your dream for how things might become.
Thank you. Indeed, it's a long-term dream of speaking the same language. And of course in Europe that has a very special meaning because we all speak different languages, but still we need to communicate. I think that with this dream of speaking with the same language and understanding each other, it's an interesting analogy. Because at the same time, we are very proud of speaking our own languages, and we think that it is enriching our cultures. But of course, it's no use if we don't understand each other. And therefore, also in this more technical world, where we are trying to come up with terminologies, it is good, sort of, that we have different approaches, but at the same time, we need to definitely make sure that we understand each other. I started in my current position in 2012, and at that time, I went through a bit my archives for this meeting, and I saw that one of the first elements which were on the work list in our unit was how to promote semantic interoperability in the European Union. Clemens Auer, who is not here today, he immediately said that he has his dream of setting up a standing committee on semantic interoperability in Europe. And I think that this dream still stays. We still need to work towards this common language. The European Union, you see the map here, the colleagues from not the European continent, you may not realize that not all European countries belong to the European Union, but many of them do, most of them do. And when I'm speaking about the European Union action, I'm speaking about the action of those countries who are part of the European Union or working very closely with the European Union. For example, we are working very closely with Norway and Iceland. Now, the European Union has been promoting several projects where we are trying to see either the framework of speaking the same language, framework for different semantic interoperability issues, or we have been trying to solve specific problems. The work on different frameworks on semantic interoperability, they come very close to the standardization issues. And actually, when I'm looking at this different documentation we have been doing, standardization and semantic interoperability, they very often go hand in hand. At the same time, we have been trying to solve some very concrete problems. One of the concrete problems is, it sounds like a simple thing. It's exchanging electronic prescription across the continent. Many of the European countries already have 100% electronic prescriptions. A prescription doesn't contain a lot of information. You can just think that it's basically the name of the patient, the name of the pharmaceutical, a little bit of advice to the patient. That's it. But even exchanging that very limited amount of information in such a way that it uniquely goes through, it's understood, and that the name of the patient is identified in an accurate way, the pharmaceutical is defined in such a way that it is dispensed as the patient it needs, and the instructions are carried over in a right way. Even that kind of a very simple, practical, semantic problem, it has caused a lot of problem, and therefore in the European Union we have had many meetings on events looking at that kind of simple thing. So a series of problems, a series of projects have been looking at either the frameworks or the practical problems to solve. Then comes the question always that should we try to endeavor having national solutions, Europe-wide solutions, or international solutions? Starting with national, that's always easy, and that's a good starting point, because in that way you can make quick progress, you can make sure that within your close vicinity you can cooperate. JUDr and SNOMED on its part is a good example, a prime example of international cooperation, where in a sense solving the problem at the highest possible level. The discussion in the European Union meetings is often that how do we balance between the national, international, and finding our own common solutions. And I think that the ethos very often in these meetings is that while we are finding a European solution, we need to make an international connection. And that is also with our cooperation with SNOMED International, or JUDr as it used to be, on the use of SNOMED terminology. Commission has been supporting the use of SNOMED terminology in the European member states. But as you know, it's the member states who are the members of JUDr, it's not the European Union. So whenever we have been working on European level systems, we have always looked at the SNOMED as a possible solution for terminology problems, but it has never been easy because the opinions in different member states vary. Of course, those countries who are members of JUDr, or SNOMED city, they normally go for cooperation. But then there are countries who have question marks and are asking for different kinds of solutions. And actually, here comes in play the diplomacy. How can we take countries together forward? I can see that there's a technical problem, so and I didn't stop for that. I came to an end.
Thank you. Thank you, Tapani. There was a slight dimming of the picture, and I was a bit worried in case it meant that the UK was gradually going to disappear. There are certain words that we aim not to use. But Tapani, what you described there is kind of an excellent view in terms of both the opportunity and the tension of Europe or national, how best to take things forward. And I'd just like to take the opportunity then to move from a national perspective and invite Peter to say a little, from your point of view, nationally, what sort of things are you trying to achieve? What would you like to see? And by all means, talk purely from an Austrian perspective. But then,
okay, thank you for that. One quick reply to Tapani on taking account national activities and European activities. Many countries are very advanced in health documentation, and many national documentation systems are already there. So it's not a question to start from scratch. To come back to the Austrian priorities, Tapani mentioned Clemens Auer, who is very interested in and very engaged in this European cooperation on data usage cross-border, cross-country and cross-language areas. And we were one of the founding members of the EPSOS, and at this time, and I'd like to go in detail because we have some time in this discussion, it was decided to concentrate on two areas, which is the e-prescription, already mentioned, and the definition of a European patient summary. And finally, after I think 6 years of EPSOS, it has been proved in this last pilot that this could work, that we use the patient summary to use information cross borders. So the idea and the concept, maybe stop me if I tell you something you already know. We have a composition of 45 value sets, information pieces, which should show the health status of a person, a physician who probably never seen this person and it's from a foreign country, gives the first information about the status of this patient. And it was an early decision, and I'm happy that the Commission decided to continue this process for this set of information to use in international standardized terminologies. And these terminologies you might all know. It's LOINC, it's ICT, it's whatever, and then it's also the SNOMED. And the strategy to not invent something new because it's already there. So to invent no new codes or new language. We also appreciate very much, and this is also the connection to the national activities. We we try also to transform this strategy to the national level and use the same terminologies even on the national level. So this is for me the connection. On the priorities, we are very interested to have interoperable solutions in place. As Austria is a very small country, in the center there's a cross-border flow of patients. We have a lot of tourists who need health services sometimes when they go skiing in the Alps, and so there is this is somehow routine, and documentation has to tackle this routine and these services. So we were interested to have something like that in place, and we are very engaged in EPSOS and now in the Semantic Task Force. Yes, we can continue. Thank you.
Thank you, Peter. Thank you. In terms of how these things have worked, and apologies if I'm saying to some people what they know very well and to others it's completely new. Because within Europe there are the open borders, the freedoms in terms of movement and so on. Therefore, part of this supporting that freedom of movement by virtue of enabling exchange of information, as for instance the patient summary and e-prescriptions, has been an important part of Commission enabling, and it's kind of helped also by some of the funding that the Commission has provided. And in the meantime, what that has enabled is a number of member states to be able, therefore, to progress and hopefully kind of expedite their own implementation as well. So it's helped both at a European level and at a national level. And again, part of what this is trying to do is to support the best treatment, the best management, the best decisions, and so on. And as part of that process, the Commission has been also sponsoring particular activities looking at different elements. And Robert, if I can move to you, perhaps if you can say a bit from a clinical perspective in terms of this issue of semantics, interoperability, and specifically in your introduction you talked about the SSCT work. Perhaps if you can talk a little about that as well.
Good morning. Thank you, Jeremy, and thank you to the organizers for the invitation. Yes, indeed. I want to start with briefly describing to you the 5 final recommendations of SSCT, which was worked almost 2 years of hard work of many experts and medical informaticians, clinicians. First recommendation that if you want to optimize the benefits of semantic operability in health data, then this needs a coherent, priority-driven strategy at the European level, especially in Europe, in multi-Europe. The second recommendation was that SNOMED is the best available core reference terminology for cross-border, national and regional eHealth deployments in Europe. And that means that with reference terminology we mean a collection of precise expressions of concepts covering all areas of medicine and organized with a logical format. And this recommendation points to the role of SNOMED as the hub, the pivot, under the hood, the thing that connects to several aspects of terminology and information running around in information architecture. So it's the best available core reference terminology. But the third recommendation then says that it should be a part of an ecosystem of other terminologies, including international aggregation terminologies, and aggregation terminology is a different word for classifications, classical terminologies that have been used to create morbidity and mortality statistics, and I'm thinking of the family, the WHO family of classifications, ICD, ICPC, ATC for drugs, ICF for functionality, and also part of the ecosystem are multilingual user interfaces, lexical terminologies that try to capture the words and phrases of the citizens, of the doctors, the healthcare providers, and the patients, in a structure that is adapted to human language, a linguistic resource. And for these kind of linguistic terminologies, there are also ISO standards with the lexical markup standard. And then a fourth recommendation was that SNOMED should be realized incrementally with adapted license, but also attention to legacy conversion. And I think this aspect of legacy conversion is really important. We have medical records, SGPs, for our patients spanning over the past 40 years. The new system that is going to come in place in Europe, will it allow us to go back in a sensible way to the old information, and what systems will we construct for legacy conversion? So if I come back now to the perspective of the end user, I think it's important to stress that patients and also physicians want to express themselves if they are interact with medical information systems in their mother tongue. That means for most of the EU citizens, another language than EU. In fact, soon, only the English will be the official language for only 4.8 million Europeans living in the European Union. So, a complete translation of all preferred terms of the hundreds of thousands of concepts in SNOMED CT in each of the 24 official languages of the EU is undoubtedly an expensive project. That should not be a problem for big countries, but it is a problem for small countries. And we should not believe that this big investment means also that this is really the ultimate solution for a credible user interface. Translating SNOMED does not solve all end-user problems. People express themselves in words and phrases, and these words and phrases need to be connected to the translated terms for the concept. And translating a concept is much more difficult than translating a term. So we would like to argue that it is possible to create a multilingual linguistic resource with the core sets of words and phrases regularly spoken in medical encounters in the EU, and not only words and phrases by professionals, but also by patients. And then to connect this resource to a pragmatic collective collection of between 10,000 and 20,000 key concepts, a core set, and it could well be the GP core set of SNOMED, for instance, as a starting point, relevant for multidisciplinary primary care, for communication with patients, and for GP specialist communication. Not trying to solve every detail of every of the 20 or 30 subdomains of medicine. Creating and managing such a resource could be a coordinated effort between the EU and the member states. And this multilingual linguistic resource should be available to the builders of EHR solutions and of interfaces between man and machine at the point of entry of the data. The concept of this core set could be linked to SNOMED, but also and directly, not through mapping, but to a general linking, one to SNOMED, but also linking to the family of WHO classification, and this remains crucial for epidemiological, clinical, and public health research. I think it will also contribute to solutions in legacy conversion of historical clinical data. In this way, the ecosystem of terminologies with a central role for SNOMED can become a true reality, and true progress can be made towards interoperability in Europe. Thank you.
Super, thank you, Robert, thank you. A couple of the points that were made from the recommendations kind of refer to implementation approaches and kind of incremental on a number of issues in relation to translation. because if you want to say a bit more.
Yes. The recommendations in let's say, maybe not in very clear terms, said that implementation of SNOMED should be incremental, not a disruptive process, but a incremental process, and that therefore sometimes the license policy of SNOMED was to be adapted to some of the wishes of the countries. And the question is where the money for semantic interoperability in the country will be invested. Will it be invested in the translation of SNOMED, or will it be invested in an end-user terminology that helps the user to relate to SNOMED? So these are all questions that every country, every member state has to decide on its own. A lot of work for each language needs to be done in the member state, but it can be done in a coordinated way, and there Europe has to play a role.
Okay, excellent. Thank you. Now, I wanted to go to Marcin next. And as you know, we planned this in huge detail. We know exactly what we're going to say. So I'm not quite sure, Marcin, which angle you want to pick up. But if you wanted to talk about implementation approaches in Poland, how you're taking things forward, to you.
Yeah, I'd be glad to, and I would also welcome all the comments for comments on your opinions on whether our approach is okay from your perspective. We will be available at our booth during the Expo, so please do not hesitate to speak to me or my colleagues, because especially when it comes to the implementation of SNOMED, we have some struggles. If we can have my slide, please.
I also have struggles.
As my minister said, in Poland, when it comes to the semantics, we have only the history of usage of ICD-9 and ICD-10. Of course, they are Polish extensions of these terminologies, and we struggle a lot with keeping up to date with the latest releases of these classifications. And in general, terminology and semantics, they were not a major point of the, let's say, eHealth agenda for many, many years. We were always chasing the projects, the central governmental systems, but not thinking much about the data analysis and the semantics, how that can improve the things. But recently, I can see a change in my country in this respect. Unfortunately for this community, it's not connected with SNOMED, but I would also like to share this information with you, because we have an ongoing pilots of the implementation of the ICF and ICNP. And from my perspective and from what I've learned all around the world, the key factor for this implementation is very good. And the rationale behind this implementation is that the people that are involved in this community of nurses or midwives, or people from the community that deals with these functions, they say that we want to make it in a better way, so that our nursing in Poland will be better, our dealing with disabled people will be better, pensions will be better managed by the state. And that's the driver in which they see the use of ICNP and ICF as a way to move things forward. And I think that's it's a very good position of start to the implementation. So it won't be done that the government sets out in the law that right now you are using this and this and not using ICD. It's like the internal internal belief of the people that are actually involved in this area, that they really want to move things forward, and through the usage of ICF and ICNP they can move things forward. Pilot project starts. When it comes to ICNP, we will. I've already told what was on the slide, so it will just be the graphical representation. When it comes to ICNP, we will have an implementation of this terminology to hospital information systems in 16 hospitals, 16 Polish hospitals. But the important thing is that it will be the part of the wider project that deals with the quality improvement in nursing care. And you can even say empowering the nurses in Polish healthcare system, because that's also an issue in Poland, and I believe that's also in some other countries. So the most important thing for you to remember is that the usage of ICNP is only one of the points of this wider project, and the main goal of this wider project is to improve the quality of nursing care. And they see the ICNP as a solution to in this respect move things forward. When it comes to ICF, we will have a pilot implementations in 50 hospitals, where we will also start to use this classification in the hospital information systems in this 50 hospitals. And what is important in this project is that the beneficiaries of this project and or stakeholders of this project, they are not only the Ministry of Health, not only nurses and midwives. We have Ministry of Social Affairs involved in this project. We have the National Pension Institution involved in this project, and all these stakeholders are very interested into shifting our pension system into the more ICF approach than rather just saying that you are unable to work. We will try to say what things you can do, not just general statement that you are unable to work. So these are the two pilot projects with ICNP and ICF, and of course SNOMED. We have come up with 2 use cases for the use of SNOMED in maybe near future in Poland. And as I said, please do not hesitate to comment on this during the Expo. First one is one of the historical problems in Polish healthcare was that let's say guaranteed medical procedures, guaranteed from the public funds. They were based on this ICD-9 Polish extension, and it's a big word that it was ICD-9, because there are also some issues with it. But as I said, we've struggled with keeping up to date. So there were some voices saying that we don't follow what is happening in the medicine, because our register of guaranteed procedures is not keeping up with what is happening in the medicine. That's why when new minister was appointed in late 2015, one of the first issues of his agenda was we have to make our system very clear and very modern when it comes to which procedures are guaranteed. And the project started, and of course my institution is providing of course the IT solution for that, but it's very simple. We are also providing let's say the semantic knowledge and semantic portfolio of what types of terminologies or classifications can we use to this project. But the most important thing in this project is of course the work of the health technology assessment people that will come up with this new register of procedures. And as for now, and it was accepted by the Ministry of Health just recently. There's a decision that we will use SNOMED also in this new register of procedures, but also the whole data model of this register of procedures will be there will be new data model, so we'll have more detailed information about the entering conditions of the patients, and some also we'll try to define some outcomes of these procedures. So a lot of work ahead of us, and it's of course not the IT work, it's the medical work and health technology assessment work. So that's one point. And second point for next year is we will try to make a ref set, because we of course know that it's impossible and even useless to try to implement whole SNOMED. We'll try to find a ref set and try to find some medical registry, just only one small one. I will look for your proposals at the booth during the Expo, in which we'll try to, in this registry, we'll try to implement some part of SNOMED CT. We've, of course, for us, the struggle is always with the translation. I tried, but I was quickly kicked out of the room just to, maybe we won't translate, maybe let's use English, but it's impossible in our country, unfortunately. So the translation is very, very hard for us. But you know, we've made a decision that I think it was 2 years ago. We've translated whole SNOMED just to see how big let's say adventure it is. The funny thing is that our main minister, he was part of the expert team that was involved in the translation of SNOMED. That's why he knows, and he supports all our initiatives towards SNOMED implementation in Poland. But now that we've come up with 2 use cases, then it will be easier for us to keep up to date with the international releases for the smaller part of SNOMED. I think that's all for now.
Okay, thank you. No, I'm pleased that your slide has covered all the thoughts about being on stage with children, animals and technology had gone through my mind, so thank you for the help in actually getting this slide. And thank you, Marcin, for hearing about the situation in Poland. Pavol, in terms of Slovakia, can you talk a little bit about your approach here? And you may want to pick up the kind of question of translation and how you've addressed that.
Okay, I would like in the beginning only shortly describe how we started with our eHealth activities. And it was good luck that as we started with some preparation, also that European project EPSOS started, so we were part of. And we made also a huge contribution to the outcomes of the project, because our experts were part of the Semantic group that proposed the structure of the patient summary and electronic prescription. At that time we started also with preparation with our eHealth project, and based on the outcomes of this EPSOS project we decided in Slovakia to implement in the first step electronic prescription and also patient summary and some supporting projects. But you know, project is always about a change, and if you start you have some resources, and when the project ends then you have somehow to maintain the outcomes of the project, and it's another way. So during this implementation we also agreed on the national level so-called eHealth law, and it describes all our institution national health information system is responsible for. But what is very important is that it also describes the structure of national patient summary that is based on the recommendation of eHealth network. We were from the very beginning part of eHealth network, and we really appreciate the work of eHealth network and fully support it. And I think that the outcomes as a recommendation of eHealth network really help to all of the participants. Well, the second very good point that is implemented in our eHealth law is the financing. We have secured the regular financing from the state budget for our eHealth activities. That is a certain part of the monies that are collected on the regular basis for health insurance here in Slovak Republic. So we can plan in the future for next projects. And we are now in the stage that we are finalizing the pilot implementation of this patient summary and e-prescription projects, and they will start on the regular basis function in the beginning of next year. So from this semantic point of view, we have used the outcomes and recommendation of eHealth network, what was quite enough for the structure of National Patient Summary that is based on this recommendation. And as you probably know, there are some parts of this structure based also on SNOMED city. But we are planning also some future projects, and we had a problem that some physicians in Slovak Republic said that all the proposals regarding eHealth network or eHealth projects came from technical people, and there is not so good communication between technical people and physicians. So regarding the technology or terminology, we would like to start the discussion. What would physicians prepare in this area? We will probably go that way, that we will place the local terminologies that are used by our physicians, and we will be now looking for a business case that will have an economical base, and then map these local terminologies to SNOMED city or something like this. Thank you very much.
Thank you, Marcin.
Yeah, I wanted to pick up some of Pavol, something what Pavol said, that they will now in Slovakia speak with their physicians and maybe somehow evaluate terminologies, but I think what is important is to show them firstly the benefits, and as I mentioned in Poland, that the community came up with the idea that ICNP and ICAF can be a solution to their problems. It has to be the same with SNOMED. In Poland we are trying to show our doctors and nurses and other healthcare professionals that the local IT systems at the hospitals or other premises, that they can do more. That's why we've appointed teams, and we are evaluating currently 40 of our main hospitals with the MRAM model, just to show them that the ICD-9 and using only these codes is somehow a limitation to the full digital transformation of the hospital, and really having decision support systems in place and really keeping patients more safer at the hospital. So that's what we will plan to also do in the implementation phase.
Thank you. Peter, you wanted to...
Sorry. like to add two thoughts on the implementation thing. The one is, as you know, we have this interoperability, these layers on the legal, organizational, on the person identification, and so on, and on the semantic and the technical. So for me, somehow, as the technical work is standing in first place in EPSOS and now, so by now it seems to me that most of the technical interoperability aspects are solved. Yeah, it's a question of implementation, money, and so. And the semantic interoperability getting
more and more important as also IT people get to know that the content is relevant, not just the infrastructure. And so maybe the content is the most important thing in this area of work. Two things. On the legal and the contractual situation, I like to say we were always been in favor, then mainly regarding SNOMED International, but also to the other standardization organization, that there is a clear legal situation about licensing, and we were always in favor to have a European solution on this, and this somehow doesn't happen. Maybe Tapani then knows more about this. As you have seen before, Austria is not a SNOMED international member country. We have some sort of contract with SNOMED International that we were allowed to use a very small number of SNOMED codes temporarily in our national electronic health record system. So this situation is somehow pending, and decision has to be taken. And the third thing is about the translation. We are part of a 100 million German speaking population area, and we are 8 million, and so there is no plan of Austria to have a big translation project to translate SNOMED into German. So we were depending in this question very strongly on the decisions which has to be taken in Germany. So and this is, I think this is still open as far as I know. I don't know if somebody's here, so you can say something about that. Thank you.
Okay, thank you. Tapani, to you next, but I might suggest that licensing discussions are something that are important, but may need to be taken in a different forum. But Tapani, if you were short, and Robert, I'll come to you next after Tapani.
Thank you. I fully agree with you that the licensing is always, it's not, in this case, not only 2 to tango, but you have 28 plus 1 to tango. But basically, there was 3 thoughts. The first thought was really by Pavel's presentation on how the international development has inspired the Slovak development, that the work in the eHealth network, the work on patient summary has fueled the national development, even to the point that you created the national law, which is then creating a new national dynamic. So that's the one thing. The other thing which in Marcin, your presentation, I was fascinated because you say that you are in a sense using this terminology to empower nurses. So in a sense you're using these terminologies to create and develop the structures and work within the healthcare sector. So that has not occurred to me before, that actually these terminologies, they can have that kind of a issue. And then I would like to come back to Don Sweete's opening presentation, because he mentioned that SNOMED International is working together with IBM Watson. And I think that would be my question to you who in the panel who are more technically knowledgeable about this terminology, is that how you see that this artificial intelligence and big data are changing the terminology work or the classification work we have been doing so far.
Thank you. Robert, the question I was going to ask you was in relation to clinician engagement, picking up some of these aspects about doctors and nurses' involvement and so on. Whether you also want to respond on the big data aspect, please.
Yes, I would like to confirm that the choice of terminology and the choice of the structure of the clinical record that you work with is fundamental for the healthcare providers. It determines the way they work, and it should also reflect their strategy of working with the patient and strategy to document whatever has happened during the consultation into medical records. And in GPs, nurses, pharmacists, these are ongoing discussions that tend to be dominated by the technical, by the choices made by technical people, and not always reflecting what the healthcare providers themselves want. And it's important, and I think that the healthcare providers are awakening to this, that it's important to discuss this, that it's important to have common understanding, to make common choices on the strategy of consultation, the strategy of documentation, and how that will be connected to terminology, to structure of information. It's a new era, and clinicians who normally have no experience, of little experience of communicating with information architects, medical informaticians must learn how to work together in an iterative process in order to streamline the processes to what they want. I would also like to come back to the translation issue and the issue of next to the translation also having lexical and user terminologies. Two big countries in Europe, France and Germany, have not taken a license to SNOMED. Yet there are 3 working languages in the EU: English, French, and German. 3 languages that have a bigger status than the 24 official languages because they are recognized as working languages. I think from these countries an initiative should come in order to address the multilinguality aspect of semantic operability, an aspect that we too often forget. But it needs to be addressed. And we can address it in such a way that we can help the end users to better interface with the systems and to make the adoption of the standards behind the systems, including SNOMED, more easy.
Thank you. Thank you. Now, I want to give advance warning to Pavol, Marcin and Peter in terms of a question coming in. What would be the one thing that would most help you in terms of progressing implementation within your country in relation to semantics and semantic interoperability? So let you think about that. Tapani, I just wanted to ask if you'd be happy to say a bit more about some of the kind of current and upcoming Europe-wide projects in terms of sharing clinical information. Yes?
Yeah, so we are now well on the way of exchanging e-prescription and patient summaries. That's really based on this long-term EPSOS project, which created a foundation. But I think that and now we are in a sense, EPSOS demonstrated the concept. It works. Now we are implementing it, making it reality for patients and citizens in Europe, starting next year. Next year we are expecting that probably 9 countries will join the system. Of course, because we are speaking about different modes, sending and receiving, and e-prescription patient summaries. The reality is not yet for the patient that wherever you go in Europe, you can get your e-prescription dispensed in any pharmacy. But at least it's a start, and I think that what has been important with that project, it has shown that there's been enormous political will to come together and to start making it happen. Many of you cannot probably figure out what kind of hurdles we have been overcoming in this process of bringing countries together, overcoming legal, organizational, technical, and also semantic hurdles. But basically, when this now is firmly on its way, it's by no means done yet. We're expecting that the last countries will come online 2021 or even beyond that. But we are already, of course, now thinking is that, if this works for the prescriptions and patient summaries, why cannot it work for some other pieces of information? Patient summary is a situation where, let's say that you are on holiday in another country, you fall ill, you are unconscious, and the hospital needs to have the basic data about you. With a patient summary, the hospital can get an idea what is your basic status of health. When the patient then goes back to his or her home country, then the patient may have a piece of paper with him or her, or just the oral information what happened. One could ask, for example, that could actually the information be flowing the other way, from the treatment center back to the patient's home country and home hospital. Now, also then the question is that population here in Europe is much more mobile than it used to be. I myself, I'm an immigrant worker. I have been living 20 years now in Brussels, and when I go back to my home country, how do I take my medical record with me back to my home country? So the question of the whole interoperability of medical record is very much on the table and discussed. And you can imagine that I hinted to you that e-prescription has its semantic challenges. When we start speaking about even bigger chunks of information like the medical record or even parts of that, then we are speaking about higher semantic challenges. But I think that the bottom line here is that it's incredible how willing the ministers and the ministries and the countries are work together in this area of information exchange. It's quite interesting to see that the countries are coming together and they are willing to discuss that kind of issues. What are the future bold steps in information exchange? And I didn't even start addressing the question of research.
A topic maybe that some people want to pick up with Tapani afterwards. I mean, one of the things for me, the experiences with EPSOS and so on, which has been confirmed actually even just this week with the General Assembly, where we had a number of countries presenting their experiences in terms of implementation. The commonality in terms of what are we trying to achieve, some of the barriers that we face, some of the issues, and then the differences in terms of approach. And although there are certain things which we do in similar ways, nevertheless each country has its own context and so on. And certainly I've found personally, whatever issue it is, there will always be another country that has thought about it, that has tried something, that has got some ideas. In our case, maybe he's tried something that hasn't worked, but you learn lessons from that, and it helps you kind of move forward. And I hope by way of a kind of lead-in to the next day and a half in terms of the presentations, the exhibition, and all the discussions alongside, there'll be the opportunities for all of us just to share with one another in terms of where we're up to, what we're aiming to do, what we've learned, and try and find ways in which we can get the best of the experience of others. Which hence was the context of my kind of wanting to invite suggestions about what I would like to see. Peter?
Yes, thank you for that. I will talk about the European level because I think on the national level we are quite on a good way, and eHealth is getting important, and we are rolling out our national systems and so on the European level for this cross-border usage of health information. I think it's still necessary to have an alignment of the legal framework. It's still complicated in respect of data protection. It's about the professional laws, who is allowed to do what, and what can be accepted by another country. How you can build this trust between the country, that what happens in one way is also legal in the other, also in case of e-prescription and so on. On the European activities, as a personal view and engagement of my own, is I think we have to work and improve and develop the patient summary and the master data set catalog. These activities are still too much IT focused. So we have not reached the stage that we can set up a common European maintenance and improvement process of the content of information we like to use. And my idea on this is to have as many member states involved in this to bring in the right expertise. So at the moment it's as I said before, it's still very IT driven, and mainly perhaps in the meetings 10% is about content and 90% is how to do it in IT way. So this should be the development. It has been started, but it's not in place yet. It's improving from my perspective too slow.
Okay, thank you. Marcin, what would help you guys move forward?
Yeah, from my perspective, I think, and I think it's not too much forward thinking. That after each international release of, for example, SNOMED, within one day I have a complete translation done automatically by some sort of tools developed by Google, Microsoft, or some other companies, because with this artificial intelligence and all the algorithms and computing power that we have, I think it will be possible in the near future that all the hard work that we have to put into translation will be somehow automated.
Thank you. Thank you. Pavol?
Well, I would like to share with you an experience of implementation. We obtained some kind of consensus in the beginning in 2010 with the argument that the specification of patient summary was made on the European level. Then we have implemented it, and it's now implemented, and we faced the problem that we were thinking about that it is only our national problem, and it is the low motivation of our physicians to fill in data into this national system, because we have a centralized eHealth system in Slovakia. And when we discussed it on the European level, we recognized that this might be a problem also in the other countries. And the main argument was that, okay, but this patient summary specification, it is good for unplanned healthcare, but for the planned healthcare, it might be somehow more bright. And we tried to extend this specification a little bit on the national level, but it opened huge discussions. So now we, on one hand, think that this will be done also on the European level, and on the second hand, we would like to put more emphasis on communications with physicians, because we would like them to have a feeling that they have also somehow contributed to this specification. And these are the main tasks, and I think that this artificial intelligence will be used later.
Thank you. Thank you. Robert, I don't know if you wanted to.
In many countries now, the eHealth system permits the GPs to upload patient summaries on the net. Belgium has reached in a few years from hundreds of thousands to millions of patients now with the patient summary. But I think that's an enormous opportunity to study the quality of these patient summaries inside each country, and to study what are the barriers that make that maybe some of these summaries are not optimal quality, that the reconciliation of the medication is not optimal. that the description of the problems that are relevant for the patient, the health problems, are either not all listed or not well coded. How does it come? And then in fact, what you're doing then is studying the interface between man and machine. Where does it go wrong at the point of entry? And I think it's really important to study that in much more detail. We have invested a lot in cross-border and technical issues, but the human aspect of where the human comes in the interface with the system. I think studying these collections of patient summaries in each country in a coordinated way through Europe will provide important lessons of what we have to do to foster semantic operability and to support the basis of the system, namely the end user.
Thank you. Thank you. Now, I hope you've got something of a sense of the opportunities kind of Europe-wide, the kind of initiatives that Tapani has been kind of enabling, and the way in which that's both involved the member states, in some cases has helped the member states to take forward their own local agenda and share with others in terms of how they can move things forward. When Peter was talking last, he mentioned kind of legal and so on. We didn't really scratch the surface of general data protection regulation, the EID regulation, the Network and Information Security Directive. There's a whole bunch of other things, which may be for a similar session the next time we meet in Europe. But thank you very much to all the members of the panel. I hope, as I said earlier, that the discussion here can serve as a stimulus for the next day and a half in terms of what can we learn from others about a number of the different issues and aspects that have been raised, and stimulate discussions amongst ourselves. But for now, I'd like to thank all of the panel for all of their input, and perhaps you can join me in expressing our appreciation for that.